Welcome back to our ongoing series with the Four County Labor Market Planning Board as we dig into their new reports that delve into a number of issues that affect our region. I'm Ryan Drury. I'm pleased to be joined again by Jordan Meisel from the Four County Labor Market Planning Board. And today we're examining a really important topic, obviously, as we look at her report on navigating the future of care. And Jordan, obviously, healthcare, it's a very touchy subject, especially in our area. I feel like it is really across the country.
Mhm.
So this may be an obvious thing to ask, but why did the Four County Labor Market Planning Board feel like the research that was done with this report was important to kind of look into?
Yeah, so as I mentioned in one of our previous episodes on the local labor market plan, one of the strongest characteristics in our region is our rapidly aging population. So we're now older than we've ever been before in terms of our region's median age. And seniors continue to make up an increasing share of our population. So, with more and more seniors living and moving into our region, we see higher care needs as older individuals are typically higher users of healthcare services. So, we know that the healthcare sector is vital to the well being of our communities. So, this report highlights some of the unique challenges we're facing in this particular sector and examines how our region's population dynamics and our rurality are heavily impacting the state of our region's healthcare sector.
Now, there are a lot of things that people are aware of in terms of the challenges that are affecting local healthcare. But when you looked into this, I'm sure you went into it knowing a lot of those challenges already yourself. But did you discover anything when you were putting this report together that maybe you weren't aware of that kind of stood out to you when you were looking at healthcare in our region?
Absolutely. So I think one of the most shocking pieces of data that was available is so when we compare our region to other economic regions in the province, we had the largest percentage growth in the population aged 65 plus. So this group increased by a staggering 42% over a 10-year span between 2014 and 2024. Yet we were the only economic region to actually experience a decrease in the number of persons employed in health occupations compared to those 2014 levels. So it really points to kind of an alarming mismatch because, on one hand, we have a rapidly increasing senior population who rely heavily on the healthcare sector. Yet, on the other hand, we have a smaller healthcare workforce than we did 10 years ago.
It's pretty staggering when you look at the numbers, a 42% increase and then a drop off in people that are working in the sector. Obviously, that's going to be a part of unique challenges to our area. I wonder what else is available in the report with respect to unique challenges that our region faces being a largely rural population. We don't have a lot of large urban centers. What are some of the unique challenges that we're facing when it comes to healthcare in our area?
Yeah, you're right. So we are a vastly rural area. So over 50% of residents in the Four County area live in a rural area that's outside of a population center. And with that comes some unique challenges when we're comparing to more urban areas. I think we're all familiar with the ongoing emergency department closures in our region, and these closures are impacting some of the most rural communities in our region. So, thinking Chesley, Durham, Clinton. And these closures are forcing many local residents to travel outside of their home communities to seek care in other communities that are similarly dealing with things like staffing challenges and overcrowding. So, in addition to barriers in terms of accessing care, when we look at the actual health of rural residents, there's typically some disparities there when we're comparing to the health of urban residents. So there was a Statistics Canada study done last year in 2025, and that study found that rural areas with fewer than 10,000 residents had a higher prevalence of chronic disease. So things like high blood pressure, heart disease, diabetes, and obesity. Um, an additional challenge associated with rural areas is the difficulty in attracting and retaining healthcare professionals. So, we think namely physicians, but really most healthcare occupations are very much in demand, especially in our region. And our rural communities continue to face disparities and are underserved compared to our urban counterparts. So there is a well-known, we call it a maldistribution of physicians. So while almost 18% of Canadians live in rural areas, only 8% of physicians actually practice in rural areas. So there's a few factors that may push healthcare professionals away from working in rural areas. So those can include, for example, economic barriers like housing and a high cost of living. We talked about that last episode. Geographic isolation. We sometimes have fewer resources like outdated equipment. And then also, more of those family concerns like, is there accessible and affordable childcare? Will my spouse be able to find work here? And can I find a suitable home to rent or buy? Those are all, some factors that may have people reconsidering working or practicing in a rural area.
Now, I want to make mention again that everybody can access these new reports, including Navigating the Future of Care, on planningboard.ca/reports. The entire report's available for you to view online. You can download it as well, and I'd encourage everybody to do that. And on that note, when people go and do that, Jordan, and take a look at this report and look into some of the more finite numbers that are available in here, I guess what are some things that you would like to, have people take away from this report when they read it and look into all of the different things that are affecting the healthcare landscape in our area? What do you want people to take away from this stuff?
Yeah, so my hope is that readers gain a better understanding of where our healthcare sector sits from that labor market perspective and the importance of targeted attraction and retention in the sector is going to play a pivotal role in the future. So the gap between labor supply in the sector and the demand for health services continues to widen as our population becomes more dependent on these services. And there's an interesting ratio called the demographic dependency ratio, and this looks at the ratio of dependents. So dependents in this case are classified as children between 0 and 14, and then seniors aged 65 and over. So it looks at the ratio of those dependents relative to the working age population. And in 2025, Grey Bruce and Huron-Perth were among the top 4 highest demographic dependency ratios in the province. So what that tells us is that we have less working age people supporting more and more dependents. And kind of branching off of that, when we look at healthcare spending for seniors, it is much more expensive than non-seniors. The Canadian Medical Association, the CMA, reported that the per person spending on healthcare for those under the age of 64, so non-seniors, was just $2,700. Compared to seniors, that average per person healthcare spending was $12,000. So this, really highlights the financial burden as well that an aging population places on the healthcare sector in the province. So with all that being said, in the coming years, it's going to be really crucial to prioritize workforce development and continue to expand the role of various healthcare providers. We're already seeing that a little bit with pharmacists and nurse practitioners. And the goal is to really fully utilize their skills and experience and hopefully reduce some of the care burdens on our local emergency departments in the area.
Yeah, there are a number of different, kind of unique solutions. Obviously, unique challenges bring unique solutions. And there's a number of different things that are being done in the local healthcare sector, that are trying to address some of these unique needs. I guess, Jordan, I'd finally ask, how would you describe kind of the outcome and information that this project provided in terms of supporting workforce development initiatives for our region? Because, you kind of keyed in on that at the end there. That's going to be a huge thing moving forward. So how would you kind of describe, the information that this project revealed in terms of addressing that?
Yeah, so I think the information in the report, of course, really highlights those challenges that are being faced in our region. And many of these challenges are exacerbated in a sense because we're a rural area and our population dynamics are a little bit different than other areas in the province. So With that being said, there are some positive takeaways and action, though, that's happening locally. And we feel that our region is well poised to tackle some of these challenges. So, a positive sign is that our labor force size continues to grow year over year. And those low unemployment rates that our region experiences may encourage even greater labor force growth and potentially attract new healthcare professionals into the area who are maybe currently in an area with a higher unemployment rate and potentially struggling to find work. We're also seeing local educational institutions like Georgian College and local Employment Ontario programs offering targeted education and training to meet these workforce demands in the healthcare sector. So, for example, Georgian College's own Sound Campus now offers a Bachelor of Science in Nursing program, whereas before students interested in that education would have to travel outside of the region to obtain that. So now they're studying and practicing local, which is great in terms of retention. And the provincial government is playing an increasingly important role in addressing these issues. So they've put into place things like the expanded scope of practice that I touched on, investments in community paramedicine. There's been increases in funding to support staffing in long-term care homes, as well as investments aimed at reducing the financial barriers of healthcare professionals working in rural and underserved communities such as ours.
And Jordan, obviously, there's a lot more stuff available in the report. It's a big read. There's a lot of great information there. This was meant to just kind of be a general look at the information available. And again, I want to mention this is the third in our series looking at these reports from the Four County Labor Market Planning Board. Again, the reports are available to view and download at planningboard.ca/reports. That includes the local labor market plan, Youth on the Move examining the why. This the third in our series, Navigating the Future of Care. And the final one to come, we'll chat with our friend Kime Ip again about closing workforce gaps, leveraging newcomer talents. Again, all of the reports available at planningboard.ca/reports. Jordan, thanks so much for doing this. It's a great report. There's a lot of really good, relevant information for people to kind of dig into in this. And I really appreciate your time chatting a little bit about this.
Awesome. Thanks so much, Ryan.
All right, we'll be back again. Our final in the series, Closing Workforce Gaps, Leveraging Newcomer Talents. That'll be next. We'll see you then.